So this month we're talking about the talus and fractures that involve the talus. And as I was saying, it's got a fairly long history. So let's dig in, so, a little bit of the goals of the talk are we're going to obviously spend some time talking about talar neck fractures when we talk about anatomy. That'll become a little more clear, and talk about ways that we approach these. If we get into the body, when are we using a malleolar osteotomy? And then, one of the questions I always have is, a fusion ever indicated? Because some of the challenges that we face with these, historically speaking, the other interesting thing is that these were injuries that they noticed in World War I with the pilots who would crash and survive the crash, and they'd have their foot on the rudder, and that the dorsiflexion trauma, that violent dorsiflexion, actually caused these talus fractures. So aviators or aviator medicine, they saw a lot of these come up. So that's kind of a little bit of a historical fact. And this is from like one of these historical papers, kind of highlighting what some of these x-rays would have looked like. It's usually related to high energy trauma. It's oftentimes there's polytrauma, so there can be distracting injuries, and ipsilateral injuries are not uncommon. Complications are pretty significant. We'll talk about a few of those here. For housekeeping purposes, if you have questions, just put them in the chat. And Jan will be kind of managing the chat and asking questions as we get going. So we're happy to talk things out. And if we're not hitting it right when you ask, we'll try to get to it or are intending to. The anatomy of the talus, hopefully everybody's familiar with where the talus sits, but it's the bottom part of the ankle joint. It's a domed box. It's got kind of a stout cylinder. It has a lot of cartilage. It's about 60% articular cartilage, and the blood supply is well-defined and tenuous. And there's three main sources. There's the posterior tib artery, and that gives you off the artery of the tarsal canal. That there's the anterior tibialis, and then there's the perineal artery. Maybe you don't have to remember the specific vascular structures, but just understanding that the blood supply is tenuous and how that plays a role. And this is just to kind of a showing what the blood supply looks like. Again, not important to memorize it, but just understanding that the blood supply is very important for the health of the talus. When we talk about fractures of the talus, we talk about, based off of anatomy. And so that is going to be the head, the neck, and the body. And the neck has one of the more classic classifications, which we call the Hawkins classification, going back to 1970. And that was modified in 1978, and then again in 2014. But this is the gist of it here, that a type 1 is a non-displaced talar neck fracture. A type 2 is a talar neck fracture that's displaced, and the subtalar joint is either subluxed or dislocated. A type 3 has a dislocated tibiotalar joint. And a type 4 has dislocated tibiotalar joint, subtalar, and talonavicular. So kind of like your three main joints. And remember, it's 60% cartilage, and it's got three big joints. It's got the tibiotalar, the subtalar, and the talonavicular joint. That's a lot of cartilage and not any significant tendon attachments to the talus as well. So the where you sometimes get this periosteal arterial supply that you might get to other bones, you don't have that in the talus. The injury itself, again, I want to kind of breeze through this and try to get to some cases, but basically you want to make sure you're getting good, high quality x-rays. So you should be getting 3-view foot, 3-view ankle. So if you ever roll into the OR with a talus fracture, you should see at least these images up. And then you want to really carefully scrutinize these. These can be sometimes missed if they're not carefully looked at. This is my own story here where, I got called, I was on call, and one of my colleagues in general surgery hobbled into the physician workroom and said, I rolled my ankle on my bike and it was all swollen. Took him down, got an x-ray, kind of was looking over the shoulder, didn't really see too much, got read as negative. And sure enough, we come back later and find that there's a talus fracture, talar neck fracture. And you can see it there. We can see the effusion with the arrows, and probably hindsight should have been a little bit more suspicious, but it's one of those things that if you're not looking for it, you can have cases where you miss it. It's important to, once you recognize it, to get it worked up. And we use a lot of CT scans, and we've talked about those. So we're going to talk about them some more. So this is a coronal CT scan. This is an image where we are looking at the front of the, looking like an AP X-ray, and we're looking at a coronal image here. Jan, when you're using a CT scan, I mean, obviously you're studying the fracture pattern, but what else are you looking for? I'm kind of alluding to it here, but.
Yeah, I'm looking for just the assessment here, if there's any impaction like in the joint here. You mentioned articular capacity, if there's any free or loose bodies or fragments within the joint, because I'm trying to look, if it's reduced, like the subtalar joint or the tibiotalar joint, is there going to be any impediment to reduction, or cause problems later on that I can get to with an open approach?
Yeah, so this is a sagittal picture. So again, if you remember, we talked about these images when we talked about like ankle fractures and some of the other injuries, but the sagittal is the CT scan cut that's looking at it from the side. And in this here, we're looking at the subtalar joint, but you can see right in the middle of the subtalar joint, there's a loose body present in that subtalar joint. So that's important to know as you're heading into the case.
Yeah, and this is these are fractures now that I've become a lot more, I would say, aggressive using some type of arthroscopy. I usually use, a nanoscope. No conflict though, but I think they can be helpful sometimes, assess some of the articular injury and make sure you're reduced.
Yeah. Yeah, I think that there's definitely an increasing role for the use of arthroscopy in a lot of these injuries. The CT scan can also highlight, maybe I'm going to put other injuries, maybe looking at the calcaneus, but also looking here, you can see that there's this fragment that kind of comes down farther into what we would refer to as the lateral process. And so that extends a little bit more into the body in this particular case. So just being aware that can have, using that CT scan to study the full aspect of the